Hi everybody, so today we have the pleasure of speaking with Emil Højlund-Nielsen, who is the CEO of Cph Nano. Now Cph Nano is a DTU spin-out company that is currently developing a test for Covid-19. So thanks for joining us, Emil.
Thank you.
Can you tell us a bit about what the situation is like right now?
So the situation is that we are in the middle of a pandemic, as most people know by now. And this has spread to virtually every country on the planet. Here in Denmark, we have about 500 people in the hospitals. And I just saw the numbers this morning. It actually looks like the number of deaths per day is going down. So that's amazing news for Denmark. But if you look at other countries, especially the US, they look like they are on a full exponential growth of the cases there.
Being as the scientist you are, what do you think the solution is?
So I think there has been various strategies. And by now, if you take Denmark or if you take the US, a containment strategy is not, it's simply, I mean, we're too far into this for this to make a possible solution. However, it's also clear from WHO that particular testing is what we need to do. And I think in testing, what we see today is basically you got the PCR, which has been running so far, where you test for RNA and it works. And especially both in Denmark, but also in the US, we have been able to ramp that up a lot, so we can do good testing. But if you want to test for that, you need a lab and you need a lot of equipment, and it is expensive and it's time consuming. So what we see coming into the market now, which I think is very interesting, is very much a simple single use. You can call it point of care diagnostics, which is simple tests, typically based on an antibody ELISA reaction. And there is a variety of different companies right now who is applying for at FDA or similar authorities to get the test approved, and we are starting to see that coming into the market now. What can make this difficult is actually how do you ramp this up on a global scale, where you're basically limited by production capabilities here. So I think what we will see in the future is that basically every country will come out with 2 or 3 companies working on their test, and then that test will primarily go to the home market.
Tell us a bit about your test.
Yes, so the test we are doing, working on now, is different than the first 2 I explained. So and it's actually based on a third principle that is called label-free testing, which means that it does not. It's a different way of detecting the virus, and this has the implication that it's actually based on a surface technology. So it's a technology where you are attaching something that is a biomolecule that is very specific to the virus, so it can detect that on a surface. And if you only need to have a very thin nanoscale layer on that surface, you can do a test with much less material, so the price can be much lower. And secondly, it's the way we do the readout is in a machine called a spectrophotometer. It's a very well-known instrumentation, which is used for food and chemicals and also medical testing. Today, it's in all the high schools and all the universities, and all the normal schools also have it. So what we're thinking here is also how do we take what is the capacity of society and how do we turn resources that are currently not being used into being something useful for diagnostics. So our approach is slightly different, but I think with what we are doing, you can increase the capacity of testing without utilizing resources at the hospital labs, which are running 24/7 right now. So it's a slightly different concept. It's based on the way we detect it, and that gives us other possibilities to utilize other resources in society. Another thing we are focusing a lot on is so let's say you get a result out of your test. So you know this patient, the patient has the virus or they don't have the virus right now. Or if there's also new tests coming out that can say if you've had it in the past. But how does that information becomes valuable to society, right? So today it's basically hospitals or you know, more or less phoning in, depending on the country. But in some countries, it's more digital, the process. But basically, providing the results to in Denmark, it's the authorities and saying, well, we have this many tested. But that doesn't really. It's a huge cumbersome process, which means you have a delay time. So what we are thinking about, what we do, which is different, is that with our system, the instrument that is doing it is directly coupled into our online system, and the data is actually available as they are analyzed. So you have, so that means you can take the data from all the different tests, and then you can actually put that together and make a map. So you can follow the development in the population in real time, and that's what we call an infection map. And I think the one thing is that you get a result, but it's just as important that result, the information, the data that result contains, is used with the highest possible outcome for society, and that is that it is available right now for the authorities that needs to use that information. And I think that's why we have a specialized solution, is that we actually have a software company, and I think this is where we bridge you can say the simple point of care, single use testing, where you get a result, but it's not collected directly anywhere, with what is really cool about PCR testing, which is that is usually in the hospital labs, connected to some kind of centralized data gathering that then goes to the authorities. So we're in between.
So I think that what we've seen until now is that it really something that people have to come together to solve. So what can people do to help you?
Yeah, so we've done a crowdfunding. It's on a Danish platform called Lendino.dk, and we did this because we could see that if you look at the whole capital situation, so the whole economical situation right now is that a lot of capital is actually, the whole economy is actually freezing a little bit now. It's getting and especially in Denmark where we have a complete lockdown. So we were struggling to get the initial funding to actually launch our product. We already have an existing product in the market, so we wanted to do a customization of that for the coronavirus, and then get that approved and then launch it. So we launched a crowdfunding campaign about 3.5 days ago. So far we raised 250,000 kroner.
That's amazing.
Yeah, to get started. Yeah, it's from about right now it's about 100 plus people. So people on average put in a little over 2,000 kroners for the crowdfunding, and I think that's amazing, and I'm very grateful for that. I think it's really, you know, people are really coming together on this one. Everyone is doing their bit. And we are in a situation now, this is actually for us, we did it because we thought it would be a great way to raise money, and also because we thought it would be actually be faster, and I think we've seen that now.
If you want to help out there, you're more than welcome to donate. You can follow the link below. It would be amazing. And if you're not in a position, just send them some positive energy, and we'll get through this together. So thank you for joining us, Emil. It's been a pleasure.
Thank you very much.
And good luck with everything.
Good luck. Bye-bye.
Bye.